Welcome to Wonder Hair Career Institute Online. My name is Livina and I will be your instructor. Today we are going to talk about catheter care. The day of your exam, you will be given instructions on your card on which skill that you have to do. If your skill is catheter, provide a catheter care to a female resident who has an indwelling urinary catheter. Your paper might read this way. You are asked to provide catheter care to a female resident who has an indwelling urinary catheter. Soap and water should be used for the catheter care. A mannequin is used for the role of the resident. So this is one of the skills that you use mannequin. Now let's talk about urinary catheter. What is a urinary catheter? It is a flexible tube used to empty the bladder and collect urine in a drainage bag. Urinary catheters are usually inserted by the doctor or the nurse. If you are working with a patient who has an indwelling urinary catheter, there are things you need to observe when you are taking care of this patient. The color of the urine and the appearance. The normal urine color is pale yellow to amber color, and the appearance is what? Clear. You don't want to see cloudy urine. If you notice that the urine is cloudy or the urine is tea colored, you need to report to your nurse. Now let's read from our checklist. We're going to start on number 3 of our checklist. Wear gloves while providing catheter care, cleaning equipment, and handling soil underpass, washcloths, and towels. So before you gather all these supplies, you want to make sure you are wearing your glove. Position towel or underpad under buttocks area before cleansing, and when care completed, remove towel or underpad or leave resident on a dry underpad. Before you start this skill, you want to make sure you put underpad on this resident. That is critical. And when you finish, make sure you remove it. Use water of safe temperature for washing and rinsing. When you get your water, you tested it, you know, okay, it is lukewarm. You want to make sure that your patient check this water also. Use soapy washcloth to clean inside labia. Change spot on soap washcloth for each washing stroke, wiping from front to back when placing inside labia. How do you clean? Front to back. Front to back. Cleanse catheter using clean area of washcloth, washing away from body and down the catheter at least 3 to 4 inches. When you cleaning the catheter, you want to hold that catheter without touching the meatus. And you have to clean that catheter at least 3 to 4 inches. But how do you know which one is 4 or which one is 3 inches? My advice is make sure you clean it up to the point where it connects to the tubing. Because I don't even know how long the 3 inches or the 4 inches might be. Use clean soap-free wet washcloth to remove soap. Change spot on washcloth for each rinsing stroke, wiping from front to back inside labia and away from body when rinsing catheter. The same way you wash, the same way you rinse. Make sure when you are washing or when you are rinsing, you are changing spots of that washcloth. You don't want to cross-contaminate, all right? Dry perineal area from front to back after completing cleansing and rinsing. When you wash, you rinse, and you dry. The same way you wash, you rinse, and what? You dry. Leave tubing free of kinks or obstruction, and keep tubing and urinary drainage bag off floor. When you finish cleaning the catheter, you want to make sure that this catheter is not kinked, because if it's kinked, the urine will not flow, and that person will be having some pain when that bladder is full. So you want to make sure that that catheter is not kinked after you finish this skill. Keep urinary drainage bag positioned lower than bladder throughout procedure. You don't want to take that bag and put it on top of the bed because you are cleaning. It has to be below the bladder. Complete skill having rinse, dry, and store basin, placing soil linen in hamper, disposing of trash, and leaving over bed table dry. Keep resident position a safe distance from the edge of the bed at all times. You don't want your patient to fall out of that bed because you push that, or you move the patient close to the edge of the bed. At every point, at any point during your procedure, you want to make sure the patient is lying at the center of the bed. You don't want this patient to roll either left or right and find him or herself on the floor. Of course, when you finish, you want to make sure your patient is comfortable. Ask the person if you need anything. That's the closing part of this. Remember your workspace. You want to make sure you clean, you dispose your linens in a dirty hamper, and dispose trash where it's supposed to be. Now, let me ask some of these questions. When a resident has an indwelling urinary catheter, the nurse aide should expect the resident care plan to include which of the following? Limiting activities by keeping the resident on bed rest, emptying the urinary bag every 2 hours, or keeping the area where the catheter enters the body clean. How often do you empty the urinary drainage bag? If you are emptying it every 2 hours, then means that person is paying more than enough. Are you going to limit the person's activity because he has a urinary drainage bag? Remember, the skill that you are doing is cleaning, catheter care. So one of the things that should be on that person's care plan is making sure that you do catheter care for that patient. That is cleaning the catheter. So keeping the area where the catheter enters the body clean. Catheter is one of the cause of UTI. So you want to make sure you do a very good job in cleaning your patient that has this catheter. So the answer will be keeping the area where the catheter enters the body clean. If you have your resident that has indwelling urinary catheter and the patient is telling you that she wants to pee, she wants to urinate, what will you do? Are you gonna say, Miss Jones, are you crazy? You have catheter. Why are you telling me that you wanna pee? Have you asked why is that person telling you that she or he wants to pee? What will you do? At least, what will you do first? You want to make sure you check that tubing if it is kinked. At least before you report to the nurse, you want to make sure you have checked this catheter, find out that everything is okay. Then if everything is okay, it is not kinked, the catheter is not out, that means there might be something wrong. Maybe there is obstruction somewhere. Now you have to tell the nurse. The patient tell you that I want to pee, I want to use the restroom, I want to go to the bathroom. You didn't check, you now go and tell your nurse, oh, Miss Jones says she wants to use the restroom. Please don't be that kind of CNA. You want to make sure you check your patient. Know why he's telling you that she wants to use the restroom when she has catheter. Make sure the catheter is not kinked. A resident has a urinary catheter connected to a drainage bag. Which action by the nurse aide shows correct handling of the catheter and the urinary drainage bag while the resident is in bed? When you are handling urinary catheter or the drainage bag, please make sure you are wearing gloves. Infection control, standard precaution. You want to make sure you have what? Glove. Wear glove when you are emptying the urinary drainage bag. We read on the checklist that you want to make sure that the bag is below the bladder throughout the procedure. When you have your patient sitting on a wheelchair, you want to make sure that that bag is positioned below the level of the resident bladder. It must not be above. Remember, it must be positioned below the level of the resident bladder. When you close from your shift, you are working 8-hour shift. At the end of the shift, you are asked to empty the bag and record, the urinary outputs. And you notice that the patient has only 50 cc in the last 6 to 8 hours. What should you do first as a CNA? When you are going there to empty that bag, you're expecting to empty or see a full bag, but now you went there and see 30 cc or 50 cc. What will you do first? You want to make sure you check that tubing. Again, make sure you check the tubing if it is kinked or bent. If it's not, then report to your nurse. But if it's kinked, then you have to straighten that tubing so that the urine can flow. Thank you for watching. I hope you enjoyed this little tip. And if you do, please subscribe and hit the notification button. Good luck in your exams. Thank you.